Shelby Brantley, Body and Face Plastic Surgery, Flowood, Mississippi. Today I wanted to talk about facial rejuvenation. I essentially look at the face as three separate units. The top third, which would include the brow and the eyes. The middle third, which would be the cheeks and the jowls. And then the bottom third would be the neck. Most of the time when we have patients who come in for consultation regarding a facelift, we'll talk about, do we need to include the neck as part and parcel of that facelift? Number two would be to say, what is the status of the eyes or the upper eyelids too full? Is the eyebrow itself drooping? And then in the lower eyelid, are there wrinkles? Is there bulging fat? Once we make that assessment, then recommendations are then forthcoming that would say how we think that we can best address whatever your problem may be. The eyebrow itself in a female ideally would be above the supraorbital ridge, which is this bony element here, okay? In a man, you would expect it to be at the supraorbital ridge. A man doesn't want a elevated or cat-like brow appearance, and no one wants to look surprised or startled. And if you think about it, startled is more raising up of the inside aspect of the brow as opposed to the tail of the brow. That's fairly straightforward. An incision out at the anterior hairline, and then we dissect and free up the tail of the brow, and then we suspend it up to a little device that's implanted into the outer aspect of the frontal skull. That device is ultimately dissolvable and goes away, but essentially it's like a picture hanger that we can suspend the brow on until it sticks back down. That a lot of times will get rid of a lot of the excess hooding that you see in the upper outer aspect of the eyelid. But in most patients, you still would need to trim some of that extra skin. And if there's a bulge of fat on the inner aspect or in the mid portion of the eyelid, that gets trimmed as well, okay? And then in the lower eyelid, if a patient has just bulging fat and doesn't really have any excess skin, then I might make an incision on the inside of the eyelid, tease that redundant fat out, or reposition it, and then do either a chemical peel, or if you have a person who has a lot of laxity of the skin and muscle, I'll make an incision under the eyelashes to the outside, the redundant skin, trim it off, and then suture it and close it in that fashion. Basically, what we're doing with a facelift, you can have like a temporal or a mini or a cheek lift, whatever you want to term it. That would be to address jowling, a deeper nasolabial fold, or a puppet or marionette line. That entails an incision that's either right here in the hairline, under the sideburn, then down in that groove in front of the ear, stopping at the earlobe. The other option would be to go straight up into the temporal region, and I make that determination based on the sideburn appearance. And you go, well, women don't have sideburns. I understand they don't have sideburns, but they still have some hair there. So you can either go through the hair and right in front of the hairline, or up like this. But basically what you don't want is you don't want too much of this sideburn area disappearing. It looks odd, and it calls attention to the fact that the patient's had a facelift. The objective with that is to have a scar that's barely perceptible. I mean, literally, you would hope that you would have to be like, oh yes, okay, I see it now. If it were pointed out to them, not something that was obscene or would immediately catch your eye, and you want a thin, not red, very obscure scar there. Now, if you're going to address the neck, in addition to pulling up here for the face, we're pulling back here for the neck. So instead of stopping at the earlobe, we come up behind the earlobe in that groove between it and the skull, and then cross what's called the mastoid, which would be that non-hair bearing area behind your ear, and then play out in the occipital hairline. And that allows us to pull this extra skin up here. An incision is made here under the chin in order to tighten these muscles, your platysmal muscle. A lot of times a strip of that's taken out, the fat underneath that's removed, and that muscle is sutured together to give you more of an acute or crisp angle, such that the chin goes back then down, as opposed to an obtuse angle where the chin just bleeds into the base of the neck. Most of the time when I'm doing those facial rejuvenation procedures, I use what's called platelet-rich plasma to accentuate the result and if you will, to foreshorten the recovery time. With it, what we do is prior to the surgery, we harvest a little bit of your blood, we spin it down, we get the platelets out of it, and then the platelets are irrigated into the area of dissection at the completion of the dissection. And platelets basically lyse themselves. They have all kind of great things that are associated with wound healing and also stopping bleeding. So diminish the amount of bruising, diminish the amount of swelling, and accelerate the wound healing process such that your downtime is hopefully a week or less. And basically that's what my approach is to facial rejuvenation, and thank you for listening. And if you have any questions, please contact my staff, and I'd be glad to bring you up to speed.